Good morning, friends. I am Dr. Kapil Raheja, pediatrician and consultant neonatologist in Vasundhara Hospital and Research Facility Center. This week, basically third week of November, we always yearly celebrate as the National Newborn Week, and today is 17th of November. We celebrate as the Prematurity Day. So today, few lines about that thing that. We have world-class facilities here with all the instruments available to save the newborns, and thousands of newborns have been saved in our center. They have definitely been treated by many of the medications, IV medications, sometimes oxygen, sometimes phototherapy. Few of them are not that lucky enough. They also may have to be given surfactant and ventilation. But all they have to have been treated with eternal love and care, and after that also we treat them as just like the baby are inside the womb, because they need developmentally supportive care in the form of very tiny small sounds of noises and very sensitive touch. These have to be given by our staff. We have all the facilities of trained staff, senior staff here. And definitely we have to also think about that the baby's temperature has to be maintained in between 28 to 30, which is just like the babies inside the womb. And outside also, once the babies are okay, once they are out of all the critical things, once we start the nutrition, they have to be given some sort of supplements at home like multivitamin, vitamin D, calcium. Sometimes they may be needed some sort of fat and protein supplement which has to be continued at home. And definitely they have to go for some sort of occupational therapies training. Few who are extremely low birth weight pain premature babies, they may need some sort of occupational therapies. Massage is very good for these babies. They may need some physiotherapy also. And definitely in follow-up, we make a strict follow-up of these babies for initially for 1 to 2 months of we have to call for the weight gain, head circumference gain, then we have to see. And definitely we have to see for the hearing and the vision also. Although the hearing now is recommended to go for each and every baby should go for the hearing test at least around first month of life, because it's the rule of 1, 3 and 6. Like we have to at least screen around 1 month. Then if there is something we have to intervene, then we have to go for it, recheck and confirm at 3 months. And if the babies have some issue in hearing, then it has to be given some sort of hearing aids by 6 months of age, so that there is no hindrance in the development of sound vocabulary. That is very important, because ultimately it is a main milestone that the baby should develop the language at the normal time. Also along with that, there we also look for other milestones which the baby is achieving, like in gross motor, fine motor. There are multiple levels of milestone which we see once the baby is coming in the follow-up, and that has to be continued for around 2 years. These babies do cope up with all normal babies within 1 year. Initially they may have some weight issues, but since if the development is okay and all the things, internal checkups are okay, then most of these babies cope up, and the parents also have coped up with all the things which these babies may have. Initially some regurgitation, some colic issues, these all have to be managed sometimes. These babies are not different from normally term babies, but there are few things which have to be managed on home basis, on parents counseling basis, and also it has to be managed on the OPD basis. Although we have to continue these nutritional supplements initially, at least for initial 2-3 months minimally, because after that, once the baby is more than 5 kgs, then we can shift on to minimal nutrition and breastfeeding, which has to be started continuously from the day of birth. And definitely we have to follow them for the vaccination, which is very important for these babies. Although vaccination is very important for every newborn baby, for term babies also, but definitely to be very specific, premature babies has initially some sort of immunity issue may be there, so these babies has to be given each and every vaccination which is recommended, and there should be no hindrance in that. And there are few things which the babies have to be managed at home, like sometimes we ask the mothers to give them good massage therapy later on, to give them very tender care. Few babies need kangaroo mother care, which is very important. Less than 2 kgs babies has to be given kangaroo mother care as early as possible. We try to start it once the baby is off of season, or once the baby is clinically stable. We start kangaroo mother care, which is very important for these newborns. And we train the mother, we tell them the position of the baby for the KMC, which is it's a short form for that. And it is also very good effects on these babies about the weight gain, temperature maintenance, making the bonding of the baby with the mother. And there are n number of studies now which are showing that kangaroo mother care is the best thing which we can do with a premature baby. So it is advisable that each and every baby, once he is clinically stable, should be started on kangaroo mother care, and we are very pro in that, apart from the breastfeeding. So these two things, if we have started timely and the mothers are okay with that, if both the baby and mother duo are stable, then we see dramatic effect in the baby, and the baby suddenly starts feeding, he starts having all the good motions, and all the things are under control once these both of things are established. So we see in clinical practice also now, as the studies have been proven this worldwide, if the baby has started breastfeeding and kangaroo mother care once he is stabilized, then the things are just go miraculous way, and the babies are healthy, going on very fast to the home also. And also we recommend the mothers that the kangaroo mother care should be continued at home also, which is very important, at least till 2-3 kgs. Once the baby is 3 to 4 kgs, that it should be continued. And after that, once the babies are okay, 4-5 kgs, then the effects of prematurity are over. But still there are some chances of vitamin D deficiency, some chances of iron deficiency, which we have to look in the follow-ups and OPD basis. So we, time to time, we have started on some supplements for that. So that can be managed easily. And regarding milestones, some of the extreme premature babies may have some delay in milestones, like a month or two, but then we always counsel the parents that don't compare these babies from the date of birth. Always compare the babies from the expected date of delivery, when the baby has to come out from the womb, because the brain development will be as per the gestational age. So it is very important to notice for the parents that once the baby, what is the expected date of delivery, that has to be calculated, and don't compare your baby कि ये 6 महीने का है and another baby who is living beside is of 6 महीने का है, वो तो बैठने लगा, ये तो अभी बैठता नहीं है, करवट नहीं लेता. तो this baby will take time. It will take another 1 to 2 months. You have to wait for that time to let the brain to come out. That is also thing. And few babies has some retinal issues. We have to manage that thing, because both those babies who are less than 28 weeks, 30 weeks, those babies who have a long time of surfactant, ventilation and oxygen therapy, so these babies may need some sort of management of the eyes. So that has to be managed very specifically. So I advise those parents who have gone through that trauma to be very patient and go for the regular eye checkup whenever it is needed. So that's all for now, and rest of the things we are always open for every patient. Anybody can call, anybody can come. We can discuss about all the issues related to prematurity, related to the caring of the baby at home after prematurity. And we always try to make each and every baby who is premature, but he should compete with all the peers, all the normal term babies in each and every aspect of life. And that's us for now. And good luck for the parents who are dealing with those babies, and God bless them. And I also want to thank at last Dr. Sanjay sir and Dr. Renu ma'am, who has built this healing center institution and given the chance to cherish all thousands of the parents who are being blessed with many of the babies with normal things or some IVF also. I want to thank at last my NICU team, and who is very dedicated and very trained in all the training teachers in managing all these babies. I also want to thank at last Dr. Jabi sir and Dr. Pravesh, who is one of my team, and they also help me in managing these babies in every aspect as possible. Thanks.